So I was assigned Jania Stone for my post-clinical discussion, and a little bit of background history about her. She is a 5-year-old who is planning to attend kindergarten in the fall. She has quite an extensive health history. At 9 months old, she was diagnosed with hydrocephalus, and a shunt was placed at that time. Then at 2 years old and 3 years old, she had recurrent shunt infections, which were treated with IV antibiotics. At 4 years old, she had all the signs and symptoms of increased intracranial pressure, which led her parents to taking her to a neurologist where they found an obstruction. So a revision was done at that time. About 6 months ago, it was found that her shunt was kinked. So it's very important that they have been monitoring for signs of shunt infection and malfunction now, since it was just recently unkinked. Jania does have 2 fathers in the home who are planning on getting married, and they have a little bit of a family dynamic going on there, and some kind of conflicts outside of their close-knit family with this decision to proceed with marriage. Jania herself has a history of frequent UTIs. She's a picky eater. She does not eat meat. She rarely eats dairy, and she does love carbohydrates. Girl after my own heart. But her parents have been reporting that she has been tired, pale, and not as active as her normal self recently. So they were concerned about that. The first discussion topic for today was the association with frequent UTIs. So there can be many different things that lead to it. Urinary tract infection. Like constipation can actually be one that leads to UTIs. And so Jania's like unhealthy diet, not eating a lot, probably not consuming a lot of fiber or nutrient dense meals made me lead to think she might be constipated, and it could be also leading to her frequent UTIs. Another risk factor is holding urine too long, not fully emptying the bladder when urinating, and also not drinking enough fluids to flush the bacteria can also lead to frequent urinary tract infections. Also, just being a girl, the female anatomy, and having a shorter urethra in women is a risk factor in itself. So the second discussion topic for today is some referral services for Jania's fathers. So this was one of our discussion examples that we did at Swift River. So we identified Family Counseling Center, the clergy, and actually play therapy for Jania as well. These were just a few of the examples in the scenario that we did. So personally, I would recommend for the fathers to join an LGBTQ support group. And if there's not one that they could find locally, there are a ton available on Zoom, especially due to the current pandemic. It's just the Zoom resources out there are amazing, and they could find a support group of couples who are going through the exact same thing, how they have dealt with it, and just use that as some inspiration to keep going, and just kind of as a backbone for them. It would be a really great resource for them to have, and just as a support group as well. I would also recommend for them to see therapists individually, as a couple, and as a family, just so they can deal with the stress in their personal life, with that alone therapy time, and so then that does not get brought into their relationship dynamic or their family dynamic, so they have an outlet for whatever else is going on in their life, which can help lead to less conflict and just a happier relationship in general. And then my third discussion topic are clients who are at risk for iron deficiency anemia. So I did identify 3 different populations who are at risk for iron deficiency anemia. The first population is young children. They're the most common at risk. I feel like this just makes sense because children do not eat that much, and when they do, it's not that healthy. this is another reason why, iron fortified foods like cereals are a thing. The other population is women of childbearing age, just due to the blood loss with menstruation, and then also pregnant women, just due to the greater demand on the body that these women have from, bringing another life into this earth. And they do recommend, pregnant women taking folic acid and other prenatal vitamins to try to combat this. And then the final population that I identified are patients with long-term illness, recent surgery, or increased bleeding. And I feel like that just makes sense as to why you would have iron deficiency anemia going on. And then what I would do for these different client populations were to help increase that intake of vitamin C, since it does help absorb iron in the body. So I would promote them drinking orange juice, eating strawberries, kiwi, tomatoes, just anything that their personal preference kind of likes, just to try to help promote that increase of vitamin C in their body to help absorb the iron that they do get. And then, especially in Jania's case, I would promote her to eat a bowl of cereal. She doesn't even have to put milk in it. I never did as a kid because I hated to eat dairy too. But, that would just help enough to try to get a little bit of that iron into our body. I'd also recommend beans. So I recently saw an article online that you can blend up chickpeas into kind of like a hummus dip, and then dip crackers in it. And I feel like that's a really simple way that you can hide a great nutrient like this for a kid to eat is in a dip. And I would also recommend spinach. Another thing you could hide, ground it up, blend it up, put it in some mac and cheese, a smoothie, or scrambled eggs. And then I would also recommend scrambled eggs, or just eggs in general. Raisins are also a great iron-packed food, and that could also help with constipation if Jania has that going on. Peas, and then I would also recommend tofu. I would recommend tofu for Jania's diet anyway, because it is often recommended for kids who don't eat meat, because it is a plant-based just food packed with a ton of different proteins and nutrients that she could be lacking without any consumption of meat. But overall, any of these foods, just trying to promote them in your diet can help increase the daily iron intake. And then the fourth discussion topic was regarding picky eaters and how to promote picky eaters to actually eat. So I was a picky eater as a kid myself, so I kind of understand. Just make it fun for the kids. Like cut their food into fun shapes and sizes, like dinosaur-shaped sandwiches, triangles, shapes, other, just random things. Switch it up. I remember as a kid, I would only eat off of those plates that had the big circle, like the bear, with the ears, and put the dips or like something little on the ears. It was fun. It was the only thing I'd ever eat off of. Just like different fun utensils. Like I said before, try some dips, different colors, textures. Just get creative, hide the nutrients where they least expect it, so they'll actually eat it. And then for Jania's fathers, I would actually recommend for them to take her grocery shopping, kind of let her be a part of that process, even though she's only 5 years old. Allow her to help, allow her to dictate her preferences, see what she likes to eat at the store. And then I think that would also help promote her wanting to eat if she has an active decision making, in the process of the food. And then also allow her to help cook and allow her to be active in the kitchen. I think that would also help her want to eat if she has a say in, helping cook and making it fun. And then another very important thing for picky eaters is to specifically designate a time for eating. So designate a time for breakfast, lunch, and dinner, and try to minimize as many distractions as possible. So maybe have a specific place that you eat where there are less distractions. No cell phones at the dinner table, no TV. Try to just focus on eating the entire time that you are there. And that should help get as many nutrients in as you possibly can while you're at the dinner table. And then the final discussion topic was how the role of the school nurse has changed from now until when I was in school versus when I was in school. And so I only saw the school nurse like once whenever I was a kid, and it was when I fell off the monkey bars really bad, bit through my tongue, and there was like blood squirting everywhere. Like, I don't think any of the teachers wanted to deal with it. So I think that's the only reason why I saw the school nurse. And I don't even think she was present. I think they had to call her in at the time. So, but I also went to a private school, so there might be a little bit of a different dynamic there. But she was just not very active or present, I felt like, in the school, like, dynamic. But it seems like the role has definitely changed with the time. It seems like there's a lot of collaboration, health promotion, counseling done. The role of the school nurse is very broad. She has to wear many different hats just to accommodate the needs of all these children and their families. It's kind of crazy. You have to account for the mental, psychosocial aspect and physical of the kids, and you have to also consider their family and how it's affecting them. I feel like this role has definitely changed a lot since I've been in school, but I feel like the times have changed as well to promote the change of this role. Not only is the school nurse managing children who have chronic illnesses that they have to give their medication at prescribed times, give insulin, other medications for children who are just experiencing, an infection or anything else like that. But she has to kind of collaborate care for like the mental aspect of children as well. Like, for instance, when Jania came to the nurse's station or came to her teacher and was saying her stomach hurt, she had to take into consideration that, Jania had a lot going on at home, that it was more of an anxious thing or worry thing that caused her stomach to be hurting, or her to report it to be hurting, rather than something actually physically wrong with her. So I think the school nurse has to be very attentive to what's going on in all of these children's lives, or they can miss a simple aspect like this. And I think that is why this role has become so challenging and diverse just over the last couple years to try to meet this demand, which is very important. If you have somebody listening to you, you can pick up on a lot of different, mental illnesses before they become serious. So I think it's very important that we promote this role in the schools as best as we can. But overall, this was my discussion about Jania Stone and her fathers for my clinical